You should listen to the legal statement also on this channel, but I am recording government contractors or subcontractors, agents of the government acting under color of law in the public fora, and they do not have any expectation of privacy, and for that reason alone it's compliant with all audio recording laws. This is simple stuff. There is no dispute here at all what happened. And so then when he cannot do the S properly, then you see him, he's trying to, then what you will see is he will ask me to, what he will say is, what neurological problem are you here for today? And everyone knows that for a neurological problem, or when you go to a neurologist, it's usually a very long visit. It could be 40 minutes, 1 hour, and even a lot of neurologists, they actually put on their website that they give you a full hour to visit with the neurologist, because the neurologist visit, unlike other specialists, it's longer than what you get with your primary care. So if you get 15-20 minutes with your primary care, you can easily get 40 minutes and 1 hour with the neurologist, and they go over your basic, all your entire body, and which he's supposed to do anyway. Any doctor which is on, the rule is that any doctor who receives, and this is not just Medicaid, but the Medicare, if you get Medicare, you're supposed to do this for all patients, which you do a complete history and a complete, almost complete physical, I guess, and you do a review of systems. But now what? He's going to try to pigeon me. He's going to try to pigeonhole and say that I have to give him a specific neurological condition for which he can treat, when in fact what he's supposed to do is he's supposed to listen through what I have and find the neurological conditions, and he's also supposed to find the other conditions. He's not exempt from the other conditions. He's still a physician. And so this is the next trick that he does, and listen to this. Okay. So after that, get to the point now.
Let's
okay. So
take a time out here.
Right.
What are you here for today?
Okay. So when that happened, apparently, well, actually, not apparently. Obviously, I had injuries to the head.
Well, I don't know.
Okay.
I don't understand what you're talking about at all with that. So,
okay.
What can I do for you today?
Okay. So after that point, what happened is my blood pressure, which was 124 over 74, went up to 165 over 85. So I know the systolic went up, and that's the problem we ran into now, because obviously now I do have a heart condition, and I didn't have that kind of a heart condition before that incident. The heart condition is diastolic heart failure. And also in the last...
I'm still not exactly clear what neurological issue you're coming in with.
Okay. That's the neurological issue.
What's the neurological issue?
So the doctor started treating for the diastolic heart failure.
No, it's not a neurological issue, that's a cardiology issue.
Okay, I understand. The diastolic heart failure is a cardiological issue. Right. It's not a neurological issue. So
what is it that we can do for you? I think we're kind of just getting into spinning our wheels here. We had seen you back in 2014.
Okay.
I think we're kind of just getting into spinning our wheels here. We had seen you back in 2014. Okay. And you would come in with dizziness and numbness.
Right.
And I had recommended some evaluation at that point. Right. And you, I guess, didn't do anything.
Right. Because
so at this point, unless there is a clear question that I think that I can help you with, then I think it's probably better if we don't go any further with this.
Okay. Well, the clear question is okay. I'm sorry.
So what is
I'll let you speak. Go ahead. I was interrupting you. Go ahead.
So what is it from a neurological point of view that you would like me to address today? Because I haven't heard anything that I can address from a neurological point of view.
Right.
And I don't want to waste your time. I don't want to waste my time.
Because what happened is,
hold on a second.
Okay, let me just hold on. Okay, go ahead. Good. Okay.
So, unless there's something that falls within my aspect of things, then I think we're just going to have to stop this right here, because I don't think that I can help you, and I don't want to take your money if I can't help you. I don't waste your time.
Okay. Stop tape. If he wanted me to just specify what neurological condition I'm here with today, he could have told me that at the beginning of the visit. Anyway, he's not supposed to be doing that at any point in the visit. So he could not sustain his life. So he came down to asking, what neurological condition do I have? And then when I also mentioned the heart condition, diastolic heart failure, he said that's to be treated by a cardiologist, and that's not a neurological condition. Well, it's true, it's not a neurological condition, but with any kind of heart failure, one of the main signs, actually one of the main signs is actually you get reduced blood flow throughout the body, and that's called poor perfusion. So you get poor perfusion, and that's one of the signs, and you actually find it oftentimes in the head, and that's clearly with a neurologist. So the neurologist, so he's actually going to be ordering me this test to check for blood flow in the head, and then obviously it's going to come back as is reduced, but then he doesn't want to recognize that the problem is coming from the heart, and we always know that, in fact, especially for like simple conditions like migraines, they always do a very good check of the heart, and sometimes heart conditions give a problem like migraines, and also when you treat with migraines, if you have a heart condition, you could make that heart condition worse. So, a neurologist is always connected to a heart condition, and so now he just wants me to specify out my heart condition, my specific neurological condition. Well, no one goes anywhere into a neurologist's office saying, I have specific neurological condition and it is this and this. No, that's for the neurologist to find out, and even what it looked like he was finding out when I told him about the diastolic heart failure, he's saying it's not. Well, if you have like a heart attack, that's probably doesn't have much connection to a neurological condition, but something like heart failure definitely does, because it's about reduced blood flow through the body, and the most important part of the body other than the heart is the brain. And so if you have reduced blood flow to the brain and you don't recognize the heart condition, you're not going to go anywhere. And obviously that's what it is. He doesn't want the proper history, and he doesn't want to reach the right conclusion. And no doubt he's working in cahoots with those individuals. That's very clear. He's not giving me my medical care. He's not giving me my medical care as specified in the law. I mean, he works for this Medicaid plan, and they have a whole bunch of rules, and it's kind of in plain English, and it actually comes out from federal law and state law. So he's completely not obeying federal and state law when he does this. And I gave him a sheet of paper. I actually have a whole lot of neurological conditions, or what he would call, and I think they're all like this. They're all part of the same thing. One of the things is because of the heart failure, and I have reduced blood flow coming out of the heart. I get a lot of shoulder and neck and back pain, upper back pain right around the heart. And also I had a CT showing in which the radiologist who read the CT who actually used the word ratty, R-A-T-T-Y. He actually used the word ratty to describe my upper back. So I'm having the spine problem, obviously, and that's actually a problem for a neurologist. And then the spine problem, and when the heart problem got worse, the spine problem got worse, and the spine actually pushes up into the brain, and that causes numbness and dizziness in the brain, and that's a neurological problem. Then I also brought to him the issue of when that I feel like sleeping many different times of the day. It's not like I feel like sleeping all day, but when I do activities, when I do like 15-20 minutes of activity or even 1 hour of activity, I feel like going and sleeping for about 15-20 minutes. And one of the issues I brought up to Dr. Whicker was, so would that be a good recommendation for me to get, I guess it would amount to frequent naps throughout the day, to help both the heart condition and the brain injury. And everyone knows for a brain injury you need a lot of rest, and also for a heart condition such as heart failure also you need a lot of rest. So I came to him to also ask if that would be okay, because a patient cannot really on his own start, even if he feels like he needs to sleep a lot, he cannot do it, because normally that is, if you don't have a doctor's recommendation, yeah, that's interesting. Even if you feel sleepy, and if you sleep, it's actually considered either you're having like a psychological problem, or you are like malingering, which means you're making stuff up. Because even for a thing like, if you want to nap throughout the day, you really need to get your doctor's approval first, and it's not something you can make up on your own. So that too I came to him with, and that's also something to be evaluated by a neurologist. A neurologist actually, when people have various kind of pain or dizziness or sleepiness or whatever kind of sensation, and it's affecting their life, it's actually the neurologist's job to figure out exactly what's going on, whether there is actually an organic etiology, or whether it's a psychological condition, or whether the person is making it up for getting some kind of benefits or something. And this is all the neurologist's job, and he doesn't want to do any of it, because obviously he doesn't want to deal with that history, and he already lied about the history. And so once you don't want to start with that history, how is it possible to go forward? So he's just going to be going from one trick to the other.